regarding the people in Gaza. The situation in the ground in Gaza, really, it is very difficult. It is more than catastrophic situation. And around 2,300,000 population of Gaza, they are gathered in the small piece of land. The Gaza, this is the Gaza Strip, around 365 kilometer, and we are in the space which is allocated to be about 25% of the surface area of Gaza. We are allocated in that ground. Everything is damaged in the northern area of Gaza, which we call it Beit Lahia, Jabalia, and Beit Hanun. All these areas are completely destructed by the Israelis. And I would like to speak about the health facilities there. We had 10 primary healthcare facilities allocated in the northern area of Gaza. All the 10 primary healthcare facilities are completely destructed, to zero land. And also regarding the hospitals in the northern part of Gaza, I would like to say that we have the Indonesian hospital now, which is out of service. We have Kamal Adwan, which is now out of service, and Nur Al Kabi. This is the only kidney dialysis center which is located in the northern area of Gaza, which serves more than around 200 population with the end stage. It is completely demolished and destructed. And now most of the people who were living in the northern area, now they are gathering in the area of Gaza, in the shelters, in the streets. And you know that the whole area in Gaza, the infrastructure in Gaza is completely damaged. I am living now in my house, which is 3 floors above me are completely destructed. And now I am living in the ground floor, which was like a space to have a rest. And in there, maybe you see the background
We don't see your
here.
picture.
This is like walls and so on. Are you seeing my picture or not?
No, unfortunately not. No.
No, يعني
I
مش
see it
عارف
on my
يعني
WhatsApp, but I don't see
انا
it here.
حاولت مش عارف وين هذه مش راضي تطلع معي الصورة.
Okay, مش مشكلة
يعني
ولا يهمك.
على العموم this is the area. And also regarding the hospitals in Gaza City, the Shifa Hospital, which was out of service in March 24 after the law and the third incursion of Shifa Hospital, which was completely destructed, the major surgical building. Shifa at that time had 20 around 32 ICU beds with a 700 capacity. And we had in that program in Shifa Hospital, we had 19 specialty, which was recognized by the Arab Medical Council. Nowadays, we reopen it again after the severe destruction of Shifa Hospital. We took the advance to return the outpatient department, even it was completely burned by the Israeli and the administration. We turned it to be an emergency department with a capacity about 60 bed, and we made the renovation of the new maternity building to be a space for surgical patients and so on. Now we have the capacity of about 140 beds and 12 ICU beds. This is a start since 1st of September 24, and now we are upgrading the services there. And now we are in Shifa Hospital. We have more than 440 patients. They are allocated in that 140 beds. So we are admitting patients in the corridor. We have what we call it a barracks, like a big tent, which is made from the metal. And it was allocated just for about 27 beds. We are admitting in that place more than 60 patients. It is not a good atmosphere to treat the injured patients. And now all injured patients are treated in Shifa Hospital with only limited capacity for the OR, which is very limited nowadays in Shifa Hospital. Just we have 3 operation theaters, small operation that doesn't fit. This operating theater don't fit the needs and the requirements to do more surgery. Unfortunately,
Dr.
we have
Marwan,
a
Dr.
limited
Marwan, Dr.
capacity.
Marwan, Dr. Marwan,
Yes.
just if I want to interrupt for 1 minute. So what Dr. Marwan is describing, especially about the situation in the Shifa Hospital, they only have 140 beds for patients and 3 ORs, down from almost 30. That's why there is an urgent need for the field hospital. The project of the field hospital, we were talking about adding another 140 beds and two ORs. And even with that, that's not enough. That's not adequate. But that just an urgent response to give them a little bit more space until they can have a more, bigger project and more long-standing plan. So, تفضل دكتور مروان. Sorry for interrupting you.
Yes, يعني we appreciated highly the project from the doctors against genocide that to start building the field hospital with about 90 or more to exceed up to 112 beds with the two operation theater. It will exceed the capacity of the Shifa hospital to absorb more patients. And regularly, on a daily basis, we are receiving more than hundreds of patients to this emergency department, and we need a space where to admit these patients. Fortunately, we have to travel and to transport these patients from Gaza City to the middle zone to other field hospitals in the middle area. So because we don't have enough capacity, but we are fortunate to have another primary trauma centers like Al Ahli Arab Hospital and other places in Gaza City, but they are not adequate huge number of mass casualties. Every day you having the scenes and shooting of the people against the area where they are giving the humanitarian aids through the trucks. They are shooting directly to the people, and we have more people they are killed on a daily basis, and more people they are injured. And just to let you know that in the south also where is the Gaza humanitarian aid, which was a killing place to kill a people. It is not for a humanitarian aid, it is just for a killing a people. And the field hospital, which is affiliated to ICRC, and the other field hospital in Zawaida area in the middle zone, which is affiliated to Masaf Belgium and the Masaf France, they are overwhelmed with the huge number of injured people. They are referring patients from their hospital to our hospital in the Nasser hospital, which is in the southern area of Gaza. Unfortunately, European Gaza hospital, which was a model hospital, they can absorb more than 400 patients at that place. They have operation theater, and the only place in the southern area of Gaza to serve for the neurosurgical and cancer patients. Nowadays, since 2 months, it is an out of service. It is in the red zone by the Israelis. So we are condensed in a small area, in hospitals. We are overwhelmed. And just to let you know that we have more than 6,000 people who have severe injuries, and they are a candidate for limb reconstructive surgery. They are in bad need for the long journey of surgical procedure and the treatment. They are in need for at least 2 years to be dealt and treated. And this cannot happen in this situation in our hospital. We have yes, but unfortunately nowadays we are started to do screening, but due to a great number of casualties, we cannot deal with this screening and to screen our patients. And just to let you know, the only center in Gaza to provide, okay, we are speaking about casualties. What about other diseases like cardiac patients? In the past, we had in Gaza more than 7 cardiac centers to do cardiac catheterization and stenting. Nowadays, we have just one, which is available in public aid hospital. This is Angio Hospital, and we are performing this procedure just for top urgent cases. We cannot afford for other patients who are having chest pain on a regular episode. Just for urgent cases, we are providing this service. And to speak about cancer patients, we are just most common cancer in Gaza and among women, and it is in the world. This is a breast cancer. We are nowadays dealing with our patients. We don't offer them conservative way of management. The only chance to cure their cancer is to do modified mastectomy, to do a radical surgery, and then to provide some sort of chemotherapy. Unfortunately, we don't have the radiotherapy. We don't have the immunoreceptors and hormonal receptor to assess the mode of management for these patients. This is for one. And again, for the kidney patients when they did end stage renal failure, just we are offering 33 machines for our patients who are located nowadays in Shifa Hospital. We are providing that in Shifa and in Rantisi Pediatric Hospital. But nowadays we are not to provide for our patients because we don't have enough machines. We are in a process of renovation, the remaining part of the kidney dialysis in Shifa, but we have a huge number of patients. We are giving now